155 exam 3 Galen, Unit 6, 11-13, 7, 24, 26, 8, 11-13. Questions and answers. Already passed. T/F. When collecting a culture from a wound, do not use pus or pooled exudates. AOE true. To prevent skin trauma from shearing the nerves, should consider using AOE alcohol-free barrier. Film. Using the RYB color code of wounds, red would what kind of dressing or treatment? AOE cover. With hydrocolloid dressing. Using the RYB color code of wounds, yellow would what kind of dressing or treatment? AOE clean to remove non-viable tissue. Using the RYB color code of wounds, black would what kind of dressing or treatment? Débridement. Normal movement is AOE, smooth and purposeful. 1/3. A patient wearing an abdominal binder is having difficulty breathing. What would the nurse do? Next. Heavy check mark, check the abdominal binder. ___ turns are used to bandage cylindrical parts of the body that are fairly uniform in circumference. Heavy check mark, spiral. ___ turns are used to bandage cylindrical parts of the body that are not uniform in circumference. Heavy check mark, spiral reverse. You show LD exercise at least heavy check mark, 30 minutes a day, 5 days a week. Isotonic, dynamic. Heavy check mark, muscle contraction plus active movement. Swim, run, walk. Isometric, static or setting. Heavy check mark, no joint movement, sit and squeeze. Isokinetic, resistive. Heavy check mark, muscle contraction with resistance. 2/3. __ turns are used to cover distal parts of the body, such as the stump of an amputation. Heavy check mark, recurrent. Aerobic heavy check mark requires oxygen. Anaerobic heavy check mark without oxygen. Figure -8 turns are used to bandage the elbow, knee, or ankle because they heavy check mark permit some movement after application. Cold applications are used for __ injuries because it provides reduction of __ and heavy check mark sports. Swelling, bleeding. Application of cold causes heavy check mark vasoconstriction. A patient is asking for a heating pad who has a sprained ankle. What would you teach? AOE 24. Hours after trauma. Heat increases bleeding and swelling. Powered by TCPDF, www.tcpdf.org. 3/3.